Hello and welcome back to HOMA Healthcare Center. Have you ever wondered about insulin resistance? Most of us get our blood sugar tested regularly, but here's an important question. Have you ever tested your insulin levels? Before we begin, if you care about your health, hit that subscribe button and ring the bell, because what we're discussing today could literally save your liver. Many people don't even know this test exists, yet it could be the missing piece in understanding what's happening inside your body, especially when it comes to fatty liver. Today we have a very special guest with us. Please welcome Dr. Muddu Surendra Nehru, MD, Professor of Medicine. Dr. Nehru, we're going to dive into a crucial topic today. For fatty liver, do we need to test insulin, and why? This is something that could change the way we approach liver health. So stay with us till the end. Let's get started.
This is a very interesting topic. Lot of people are surprised, and many doctors are surprised why for fatty liver you have to do insulin test. In what way insulin is linked to liver? Routinely when my friends are radiologists, they do a ultrasound. Every day they tell me out of 100 patients, 95% of the Indians are having fatty liver. Both men and women, young and old, and more so above the age of 50 years, and more if the women are post-menopausal. And in India we are doing hysterectomy at early age, so post-surgical hysterectomy, they are getting fatty liver at very younger age group. So this is very, very common finding nowadays in ultrasound. If you see a report, many of my colleagues and friends and my close friends, they ask me, sir, I got a report of ultrasound showing fatty liver grade 1. Should I be worried? And surprisingly, they are all healthy, and they don't know that they don't have the sugar is normal, BP is normal, cholesterol is normal. Then why do I have to worry? Is it fatty liver grade 1? After 8 years or 10 years, they are all becoming diabetic, or some of them they are developing heart attack, and majority of them they are having hypertension. One common factor in all these people that I see, one is above age of 30 years. Second is most of the sedentary. Means we are all working in the house, we are working in the office, we are busy now actually when compared to 100 years back. But the amount of calories that we are burning are less than 30 calories. But the amount of calories we are eating are more than 3000. So there is a more than 90% of energy difference between your consumption and the way you are eating. That is why every day you are getting nutrient excess. All these extra calories that are there in the body, the insulin is a hormone which is produced in the pancreas, which is there in the stomach, which controls how much of sugar should be there in the body and how much of fat is there in the body. Even now in medical college we are teaching that sugar is controlled by insulin and protein is controlled by growth hormone and fats are controlled by lipase or some other hormone. We are still thinking that there are all three different sections. No, now we found out that human body can interregulate or interchange between carbohydrate and fat. Coming to this particular subject, whenever you see a grade 1 fatty liver, if the waist circumference is more than 85 cm, man or woman over the age of 25 years, then you get a fasting insulin test. The name of the test is HOMA. So fasting insulin to fasting blood sugar divided by 405. For example, your sugar is 80, you think you are non-diabetic and you take a biryani and a beer, you will get a blood sugar test. Still it will be only 85 to 95. You think you are not a diabetic, but all your sugar carbohydrates that are there in your biryani and your beer and your cool drinks, they get converted into triglycerides and they are stored in the fat. So we have a gene wherein the insulin tries to convert all your sugars into fats and store in the abdomen. So slowly, without knowingly, your waist circumference goes on increasing from 33 inches to 36 to 40. Now every Indian men and women are above 40 inches of waist circumference. Either 33 inches of waist circumference or 85 centimeter. All these people, they must understand that they are having already central obesity and insulin resistance, and they should check before they go into fatty liver, going into steatohepatitis, MASH, metabolic steatohepatitis, and cirrhosis of liver. All this can be prevented provided public gets a real knowledge. Unfortunately, in India, there is a 99% of our medical knowledge is given by quacks or overhype, uneducated, illiterate, or people who are no way in touch with the medicine. They are giving just for sake of TRP ratings and all. They are confusing the public. My request is, you play with your TikTok and your Instagrams and all and Facebook, but don't come to health. This is a serious issue. There are 80 crore Indians who doesn't know anything about health, and they require true knowledge. So if you feel this video is useful, as you can see in this picture, the fatty liver is progressing to steatohepatitis, to cirrhosis of liver, and then to cancer. This can be prevented if you can do a fasting insulin test. This is a study which has come out in 2024, which I have shown in the screen. So I request all the doctors, radiologists and gastroenterologists, physicians, cardiologists and general public, if you see a patient, anybody who is healthy, no sugar, no BP, waist circumference more than 33 inches, if they do ultrasound, if the ultrasound shows fatty liver, and then you get a fasting insulin test, HOMA. We are doing a triglyceride to glucose index. With that, you can manage in the first stage itself. Thank you. I request everyone to comment on this and have a lively discussion on this. Debate with me. Have any doubt, you can
comment below. What's your biggest takeaway from today's discussion?
Have you been diagnosed with fatty liver? Share your story. Let's support each other. What questions do you have for Dr. Nehru? Drop them below. If this video helped you understand insulin resistance better, smash that like button and share it with 3 friends or family members who need to hear this. Don't forget to subscribe if you haven't already. We're building a community of health-conscious people who want real answers.
See you in the next video. Stay healthy, stay informed.
Thank you once again, Dr. Surendra Nehru.